We are live. Okay, we're live. Good morning, everyone. Thank you very much for being here today. I'd like to call the October 3rd, 2022 San Diego LAFCO meeting to order. And Tammy, could you make sure we have a quorum and call the roll, please?
Yes. Commissioner Desmond?
Here.
Commissioner Anderson?
Here.
Absent. Commissioner Cates? Is absent. Commissioner McKenzie? Here. Commissioner Willis?
Here.
Commissioner Vanderlyn?
Present.
Commissioner McNamara?
Here.
Commissioner Salas? Is absent. Alternate Commissioner Becker? Commissioner Becker? Okay. She's present. Alternate Commissioner Vargas is absent. Alternate Commissioner Von Wilford is absent. Alternate Commissioner Drake?
Here.
Alternate Commissioner Mathis? Is absent. Is absent. Alternate Commissioner Anderson? Excuse me, Commissioner Anderson?
So, as you see him come in later, mark him in.
Alternate Commissioner Becker will vote in place of Commissioner Salas, who is absent.
No, Salas is here.
I'm sorry. Well, no, for the record, Commissioner Salas is present. So we have 6 members present. There's a quorum.
All right, thank you, Tammy. And just a couple of staffing comments before we get into things. Our Deputy Commission Counsel, Alex Garrison, is standing in for Holly today, and he's doing so by video. And I'd also like to welcome a new staff member, Michaela Peters, to LAFCO. Where's Michaela? There she is. Thank you for helping to manage the e-comments that are coming in during the meeting, and welcome to LAFCO. So thank you very much. So can I have Mayor McNamara, could you please lead us in the Pledge of Allegiance?
Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, and the republic which stands one nation under God, indivisible,
Visible, delivered, justice for all.
Okay, everyone, thank you very much. We got the agenda review. Keith, do you have any updates for today's agenda?
Well, thank you, and good morning, Chair, Commissioners, and guests, both here in room 302 as well as participating online or by phone. So with respect to the agenda, no changes today. Everything that staff posted early last week has held. And that means, among other things, Commissioners, you will be considering a proposal as part of a notice public hearing to transition ambulance transport services out in the Heartland area, Santee Lakeside, with by our count about 140,000 residents or so. And then we do have a couple of business items of interest, one of which is a contract for advisory human resources support with regional government services. And then we also have a unique informational item involving my administrative approval of an outside service extension for Palomar Healthcare District, which I know is going to generate some comments both on the dais as well as among audience members. And to that point, I know that some of you in room 302 have already filled out speaker slips. Wonderful. If there are any others in room 302 that would like to address the commission for any item, there are speaker slips at the front table, and then hand them off to Du, and he will make sure that they make their way to the chair. And then if you are participating today by way of video or phone, just reference the instructions that we have on the agenda face sheet with respect to either registering to directly address the commission or provide an e-comment. So with those instructions noted and our agenda being confirmed, we're good to go. Thank you, Chair.
All right, King, thank you very much. How about any commissioners? Do they have any updates or changes any commissioners would like to make to the agenda at all? Let's see. Anybody online? Hopefully I've got it right in front of me here. I see none. Anybody else see any more? Is any? Okay. Okay, good. All right, so we have no changes or updates. We'll move into the public comments and related requests. Do we have any public comments for anything that's not on today's agenda or anyone calling in or online?
I've received no registered speakers.
All right.
And then just for purposes of procedure, we'll check in with Michaela during these items to see if there's any e-comments. So any e-comments for just general public comment?
No live email comments.
There we go. Thank you.
Thanks, Michaela. Okay, moving on to our consent items. This is 5A through H. We've got 8 items on consent today, so would any commissioners want to pull any items for discussion or make a motion? One thing to note is on 5H, I'm going to be voting in favor of alternate 2, which is that we have today's meeting as a hybrid, but this would be our last one, in my opinion. I know many of the commissions that I serve on, and we're all in person again. And so I'd like to see us go back to that. But is there a motion or any comments on consent?
I'll make a motion to approve the consent calendar, but I also have a comment on the same item.
So would you want to make?
Anderson seconds.
So is that a motion with alternate 2?
All 5, well, it's not all 5, all 7, all A through H,
A through H as,
at this point in time, yes.
and then what's alternate for number H? 1 or 2, to keep remotely for alternate, okay, position.
I'll be right there.
Okay,
But my comment is with the passing of signing of AB 2449, there is now a difference in how hybrid meetings are held and how often a commissioner or council person can, actually not attend in person. So maybe what we could do is bring that AB 2449 back on the next agenda for discussion and how we're going to proceed from there.
Will do.
all right, thank you very much. So we have a motion, a second. Is there any other discussion? Yes.
A brief comment on 5D, which is the Escondido wastewater services for the county park. I'm very much in favor of this because we've got a lot of septic services that are deteriorating in that area. I think the city can do a very good job of improving the human health in that area.
All right, thank you. I have a quick comment on item 5G. I want to thank Keen and his team for working on this planning and development services grant opportunity with the county. Hopefully we'll get these dollars coming in. And so thank you very much for that effort and that work. So we have any other commissioners who want to talk or comment on any of the consent items? Or pull one? Okay, so we have a motion and a second. I think it was a motion by Commissioner McKenzie, second, I think I heard Supervisor Anderson making that second. We have a roll call vote, Tammy.
Yes. Commissioner Desson?
I'm going to vote yes, except for 5H. I register a no vote on 5H. I think we should go back to regular meetings. Thank you.
Commissioner Vanderlin?
Yes.
Commissioner Anderson? Exception. Commissioner Kate? Absent. Commissioner McNamara?
I vote aye, but if we're allowed to do a no vote, I also agree with Supervisor Desmond, a no on H.
Commissioner McKenzie?
Yes.
Commissioner Willis?
Aye.
Commissioner Salas?
Yes, with the no vote on that item, the AH. No, 5H.
So have 6 on 5. 5A through G, yes, and then 1, 2, 3 no's for 5H. The motion passes.
Okay. Thank you very much. Okay, moving on to our public hearings. We've got one item before us today, item 6A. Before we get started on 6A, do we have any ex parte communications from anybody on the commission, alternates or commissioners have anything to disclose?
Now, are you asking for ex parte?
Just for 6A.
Okay, thank you.
Okay. Hearing none or seeing none, nobody's, okay, Keen, could you kick things off for item 6A, please?
Would love to, and I will kick this over to Carol Neronin for the staff presentation.
Thank you. Good morning, commissioners. So today I'm going over agenda item 6A, which is a proposal that we received from the County of San Diego, which is looking for LAFCO's approval today to legally dissolve County Service Area number 69. Now, as detailed in the agenda report, the proposal necessitates the following concurrent actions by the commission. Sorry, excuse me. So, as I was saying, the proposal necessitates the following concurrent actions by the commission. The first being to dissolve County Service Area number 69 and its ambulance transport function. And secondly, to designate Lakeside FPD and the City of Santee proportionally as the successor agencies for CSA 69's ambulance transport function. And also to annex approximately 679 acres that are located in the Bostonia and Pepper Drive areas to Lakeside FPD for ambulance transport services only. Now, I'd like to mention that the fire protection and emergency medical services will remain with San Miguel FPD as they are the current provider. Now, I have prepared a PowerPoint presentation that will be brought up here on the screen, and I'd like to direct your attention to that. Soon you will see a map of County Service Area number 69's jurisdictional boundary, which we estimate spans approximately 63 square miles and has an estimated resident population of 135,468 residents and 91,332 registered voters. Now you'll see here that the map has been divided into 3 areas. You have Area 1, Area 2, and Area 3A and 3B. Now Area 1 is the portion of CSA 69 that overlaps with the City of Santee. This area spans approximately 10,685 acres and has an estimated resident population of just over 60,000. Now, as for area number 2, this is a portion of CSA 69 that overlaps with Lakeside FPD. This area spans approximately 28,938 acres and has an estimated resident population of 62,848. Now, as for Area 3, this represents the portion of CSA 69 that lies outside of both the City of Santee and Lakeside FPD. This area spans approximately a combined 679 acres, and as you see here on the screen, it is divided into 2 non-contiguous areas that are identified as 3A and 3B. Now, the application, as you'll see here on the next slide, includes a couple of negotiated terms between the subject agencies, and as shown on the screen, they include but are not limited to the following. The first is that the 2 successor agencies will create a joint powers authority to manage the provision of services for CSA 69 in the same scope and manner as is currently being provided. The 2 will also assume all costs and responsibilities for services, which include dispatch, billing, and other administrative costs, and they will determine the transfer fees for residents and non-residents. Third, all CSA 69's property tax allocation, benefit fees, and reserves will go to the 2 successor agencies for the sole purpose of providing ambulance transport. And lastly, the successor agencies will maintain the current ambulance transport levels consisting of 4 paramedic ambulances that are staffed 24/7 year-round, and 2 of these are provided by each agency. Now, the agencies have also agreed to a property tax exchange, which provides a 100% transfer of the current allocation of property taxes that are going to CSA 69 to Lakeside and the City of Santee, proportional to the percentage of the total acreage that will be assumed by the agencies for ambulance transport. Now, as for staff's analysis, the agenda report attests that the proposal is justified under both adopted policy and statute. Now, given the above justification, the reference justification, the staff is recommending the commission approve the proposal, but with a modification that includes expanding the proposed annexation to Lakeside FPD to add an additional 3,274 acres, which on the next slide you'll see will have a map that references this area. It is notified as Area 4. Now, the modification is recommended to help remedy a lapse condition of the Commission's earlier approval of the CSA 135 Islands reorganization. This was done back in February 2019. This proposal helped establish fire protection services to approximately 21,000 acres that are located in East San Diego County by annexing these lands to 5 local fire agencies. And among this annexation was the aforementioned 3,274 acres that were meant to be annexed to Lakeside FPD, but for various reasons, this remains incomplete and pending. Therefore, staff believes adding this annexation to the proposal through the Commission's modification powers is an appropriate remedy. Now, staff's recommendation also includes a conforming sphere amendment for Lakeside FPD, as well as the conditions that have been requested by the subject agencies through their negotiated terms. LAFCO's own standard conditions, which involve mostly technical issues, are also part of the recommendation. Now, I do want to mention that protest proceedings would apply should the Commission proceed with an approval today. And as allowed under both policy and statute, it is further recommended that these be delegated to the executive officer. Now, I would like to make a final note before concluding today that the property tax allocation that was documented in the written report does merit a brief slight correction. As on that note, I'd like to conclude my presentation, but should you have any questions or like any additional details, I am available. We also have a few representatives from the subject agencies present today to assist as well. Otherwise, thank you for your time today.
Thank you, Carol. Chair, if I could just double down on a couple of points, because this is a rather layered proposal. So as Carol mentioned, what the county through its surrogate CSA 69 has brought us with the partnership of the City of Santee and Lakeside Fire Protection District starts off with the fundamental dissolution of CSA 69, right, and its ambulance transport services. We are then going to proportionally assign ambulance transport services to Lakeside Fire Protection District for the overlapping lands that are already within its boundary in the City of Santee, that's already within its incorporated boundary. We are then going to annex 2 distinct areas, plural. One is about 627 or 670 acres of existing land that's already in CSA 69, but it's not either in Lakeside or Santee. Through the negotiations, we want to put this into Lakeside. So all of 69 is covered. Then as Carol mentioned, and this gets a little complex, we decided, hey, why don't we cure a omission on staff's end from 2019, where we had this massive proposal that 5 fire agencies brought us. And among other things, we're taking this opportunity to flex your discretionary muscles and add to the proposal this annexation of 3,200 acres to Lakeside. And that would allow us both to complete this proposal plus complete the 2019 proposal. So I just wanted to make sure the commission is aware of that. We do have a track change version of the resolution. I believe all the agencies have signed off on. I think we have representatives from all here and they're all nodding affirmatively, which I appreciate. So with that clarification, Chair, I'll turn this back to you.
Okay, well, thank you very much. Do we have, I understand we have no speakers on this item. Listen, I see that our first responders are all out here. You're nodding your heads. This is a good thing. Thank you very much. Do we have any of our commissioners that either online or here in the person who want to make any comments?
I just have one clarification.
Sure.
On the map 1, 3A and 3B, that's the additional acreage that's going to be going to Lakeside.
Could you pull up that map just so we can follow along? And then Carol, let's see.
And those that have acres 173.
So the areas that are identified, that the area 4 is the, well, here we're back on the 3A and 3B. Those are the combined 679 acres that are going to Lakeside for ambulance transport. But on the second map, you'll see area 4, that's the modification that we're referencing for the additional 3,274 acres from the previously lapsed proposal.
that goes out to their spirit. But 3A and 3B, aren't they in the city of El Cajon?
They are not, they're actually, 3A, I believe, is what we generally refer to as Bostonia. 3B is Pepper Drive. It's actually in Chris Brainerd's San Miguel Consolidated Fire Protection District. What we're doing here is just adding it to Lakeside just for ambulance transport services.
Okay. Any other questions, comments, or motion by any of our commissioners?
I'm going to make a motion to go through the recommendation. Yeah.
Okay, we have a motion and a motion by Commissioner Willis, second by Commissioner McKenzie. Any other discussion? I gotta pull up my participants. Oh, do we have a comment online?
Yes.
Thank you. All right, Kayla, you're on.
Okay, we have one comment from Richard H. He says, from my perspective, CSA 69 is solvent and functioning well. I do not see the need to fix what is not broken. From what I can tell, this is just swapping one type of entity for another since the same parties are in each one. Is this being done because some think the 40-year-old CSA isn't fancy enough? In my opinion, JPAs create more bureaucracy and overhead than the current system has. What is the benefit to the taxpayers? Right off the bat, if the JPA is created, almost $400,000 is expended. Is it unnecessarily wasted money? Again, how does this benefit the taxpayer? If CSA 69 is dissolved, how will the successor agencies fund this service? I presume the tax line on my property tax bill will disappear since this is not what the voters approved in 1980. What type of taxing authority will be granted to this new GPA? And I strongly oppose this dissolution as the entities pushing this have not demonstrated why it should move forward. I feel the taxpayers who created and fund CSA 69 have not been informed of this potentially major change.
Okay, Mr. Collins, I see you in the audience here. Could you address some of these concerns? Sure. Thank you.
Good morning, Commissioners. Jeff Collins with San Diego County Fire. CSA 69 is a part of our EMS office, which is part of County Fire. The CSA was formed in 1974. It's been an outstanding partnership with Santee and Lakeside. Should the commission approve this dissolution, fortunately for the residents out there, that service is going to continue. So they will still enjoy that level of service. The benefit fee, there was a question about if the revenue is going to continue, that benefit would continue. And so from our vision on this is that we see this more as local control. We have an administrative layer of government in the CSA. The service is being provided not by the CSA, but by Lakeside and Santee. That's going to continue. So this is a measure of local control, bringing those decisions on that level of service closer to the residents that are being served.
Right. Thank you, Jim. Appreciate that. Okay, hearing no other comments or any online, I gotta pull this screen up.
Any more comments?
One more.
Wait, one more? Okay, go ahead. Thanks, Mikhail.
This is a follow-up from him. He said the notation has shown that fees may be charged, which we do not currently pay fees for transport. This is not what CSA 69 voters signed up for.
All right, thank you very much. Okay, any other discussion or comments? Anyone? I'm looking online, I don't see anything. We have a motion and a second on this item. Tammy, could you call the roll, please?
Commissioner Vanderlin,
Yes.
Commissioner Anderson. Absent. Commissioner Kate is absent. Commissioner McNamara,
Aye.
Commissioner McKenzie,
Aye.
Commissioner Willis,
Aye.
Commissioner Salas,
Aye.
Commissioner Desmond,
Aye, thanks.
6 in favor, 0 opposed, 2 absent, the motion passes.
All right, Tammy, thank you very much. Okay, next we have the business calendar coming up. This is item 7A, B, and C. First, we're going to do 7A, which is the Palomar Tri-City issue here before us. I have an ex parte disclosure. I spoke with both Palomar Hospital and Tri-City Hospital. From Tri-City, I talked to CEO Steve Dykeman, and board member Rocky Chavez. Also from Palomar Hospital, I spoke with Chris Brown, the representative of Palomar Health, and also CEO Diane Hansen. So it was a busy weekend.
Mr. Chair,
They want to disclose or need to.
Mr. Chair, Andy Vanderlaan here. I also had a discussion with Chris Brown.
Okay, same, very, very, McKenzie.
Yes, I got this phone call from Chris Brown, and I also talked to Dr. Chavez, board president for Tri-City.
Yeah, go ahead, Erin.
Yes, I had a discussion with Rocky Chavez over the telephone, and my staff member Jackie Camberos had a discussion with Chris Brown.
We all had a busy week.
Chris was busy.
Anybody else online? Any of our commissioners? No?
No.
Okay. All right. So with that, we got the ex parte out of the way. So Keen, you got a presentation on 7A.
We do. A week ago, I probably wasn't going to have a presentation, but given the interest in the item, staff is going to tag team this. I'm going to ask Carol to cover the broad points. And then before we hand it back to the commission for some feedback and hear from some interested attendees, I also am going to probably want to drill down on a couple of policy points. But with that, Carol, let's go ahead.
Awesome, thank you. All right, so before the commission is a notice of an administrative out-of-agency service arrangement by the executive officer involving Palomar Healthcare District. This notice is being provided to the commission for information today consistent with adopted policy. This same policy notably delegates and authorizes the executive officer to approve out-of-agency service arrangements when addressing any public health or safety threats. With this delegation in mind, and in referencing a map that you'll soon see here on the screen, the executive officer reviewed and approved a request from Palomar Healthcare District to immediately provide OB/GYN medical services outside its boundary and sphere of influence through agreements with Vista Community and True Care clinics and source to their offices in Vista, Oceanside, and Encinitas. Now, the executive officer's approval is detailed in the accompanying agenda report and is premised on determining a public health threat does exist for the clinics and for the clinic's clients, which are primarily mothers and their babies. And this is in respect to receiving safe and reliable OB/GYN medical services as evidenced by the clinics approaching Palomar. Now, specifically, and as attest in the materials provided by Palomar and the agreements in themselves, these two clinics on their own determined that their clients would best be served by redirecting them from their previous partnership with Tri-City Healthcare District to Palomar Healthcare District. Now, before I conclude my presentation on this item, there are two things that I would like to note. The first is that this administrative approval does suggest a more micro review of healthcare services in North County, and possible boundary and sphere sync-ups will be merited when the commission takes up its review of healthcare districts in the year 2025 and 2026. Second, and lastly, while this item is for information, the commission can and should provide direction for possible future action if the membership collectively agrees that this item merits revisiting, given you are the ultimate authority on all LAFCO tasks and statute. Now, I would like to conclude my presentation and pass this back to our Executive Officer King. Thank you.
Thank you, Carol. So a couple of just points to drill down on. As Carol mentioned, and I think as you can infer, this is a otherwise unique item for LAFCO. At the end of the day, it's a judgment call. So I proceeded to approve Palomar's request to provide outside OB/GYN services based on a public health and safety finding as allowed under statute, and as you delegate me to make that call under local policy. And I spent a lot of time, because I know some of you have asked me, how did I get to this decision? Well, at the end of the day, I decided the best approach was to provide deference, great deference, as the phrase in LAFCO statute is, to the two subject clinics, Vista Community and True Care clinics, and their stated interest and concerns in making reliable and dependable OBGYN services to their historically underserved clientele. That's what your staff ultimately relied on in making this otherwise discretionary judgment call. The commission, okay, may collectively believe or prefer a different method be used. Fair enough. However, your policies delegate the decision to me. So as we present this information item to you as required under policy, certainly if the collective will of the commission is for me to revisit my approval, I certainly will take that into account. My decision is final, but there's nothing in policy or statute that prohibits me from revisiting it should new information be presented, or if the commission expresses a temperature check on anything and all of the above when it comes to making a public health safety fund. So I know we have a number of attendees who would like to speak on the item. We've asked Palomar to be here to address questions should you have them for them, but I know we have Tri-City and I think we have a few others online, Chair. So we are here to answer questions.
All right, thank you very much. Appreciate the discussion, and I think we'll probably hear from the public speakers, and then we'll go to commissioners on this item, because I know we all have heard from people, but and I guess Palomar Health doesn't have any speaker requests, just answer any questions. Okay. All right, first of all, we've got Steve Deitlin from Tri-City Hospital, followed by Dr. Jean Ma. Is that right? Sorry if I'm mispronouncing it. And then Melissa Truth, or I'm sorry, Tara, sorry. Butchering names, I apologize.
Good morning,
Steve.
Steve Line.
I'm sorry.
Yep, Dylan works too.
Sorry.
However you want to say it.
Sorry.
It's a lifelong thing, so I'll answer that. So good morning, Mr. Chairman, Commissioners, Executive Officer, and LAFCO staff. Thank you for providing the opportunity to come this morning. My name is Steve Dietlein, or Dietlein if you want. And I'm President and CEO of Tri-City Healthcare District, which operates Tri-City Medical Center in Oceanside. Our district has faithfully served the communities of Carlsbad, Oceanside, and Vista for more than 60 years. With a dedicated mission to advance the health and wellness of the community we serve. I'm here before you today with other representatives from Tri-City Healthcare District to request a review of critical and pertinent information in order to appropriately revisit and reconsider authorization for Palomar Health District to provide OBGYN medical services by contract outside its judicial boundary and sphere of influence. And I heard the executive officer say that's a possibility, so I'm here to say I appreciate that possibility and requesting it. I'm joined by a number of Tri-City Healthcare District leaders, including Rocky Chavez, Board Chair, Dr. Jean Ma, the Chief Medical Officer for Tri-City, Aaron Bizak, Chief External Affairs Officer, Melissa Tara, Director of Maternal and Child Services and Newborn, as well as several subject matter experts should you have any follow-up questions for Tri-City. First and foremost, Tri-City Healthcare District continues to provide quality service excellence for women and newborns, and we have for years. On August 1st, Tri-City received LAFCO's notice to alternative service provider that included Palomar Health District letters to LAFCO. On August 5th, LAFCO issued a notice of conditional approval to provide hospital-related services outside its existing jurisdictional boundary. As well as sphere of influence based on documents provided by Palomar Healthcare District. Unfortunately, LAFCO was not provided true and accurate information from Palomar Health District to support its claims. In fact, the Palomar Health District letters received by Tri-City Healthcare District just 4 days prior to conditional approval contained downright false and grossly misleading statements regarding the capability, capacity, and services at Tri-City Healthcare District. In addition, Palomar Healthcare District submitted these letters and requests for permission to provide services originating outside its jurisdictional boundaries and to contract for services with Vista Community Clinic and True Care. In reality, Palomar Health District had previously arranged to provide services well in advance of requesting LAFCO approval. In fact, Palomar Health District executed 3-year contracts with Vista Community Clinic and True Care, directing clinic patients to deliver at Palomar Health District outside the district they live in without LAFCO approval or having any discussion with Tri-City Healthcare District, demonstrating a total disregard for district boundaries and LAFCO. The public health threat alleged by Palomar Healthcare District, we don't believe is valid. Tri-City Healthcare District services, facilities, capacity, and capability remain robust for the community we serve. What is under threat is district boundaries that are set by LAFCO. Unfortunately, this is not the first time Palomar Health District has ventured into Tri-City Healthcare District without appropriate approval from LAFCO, demonstrating a troubling pattern that needs to be addressed appropriately. Patients living in Vista and Oceanside should not be directed to travel 15 miles for delivery when a full complement of services is available for them at their home hospital in Oceanside, Tri-City.
All right, thank you, Steve. D-line. All right. We have Mr. Jean Ma, or Dr. Jean Ma, sorry. And then also Melissa Terra, and then Rocky Chavez, please.
Good morning, Mr. Chairman, commissioners, office staff. My name is Dr. Jean Ma. I'm the Chief Medical Officer at Tri-City Healthcare District and an emergency room physician for over 22 years. I'd like to provide a little historical context for why we're here today and begin to outline some of the challenges that have resulted from Palomar Health's actions. For almost 2 decades, Tri-City was the exclusive labor and delivery and neonatal care provider for both VCC and True Care, formerly North County Health Services. We did this without contracts, without remuneration, and without a request to provide services outside our district. And we never created this facade of a public health crisis. Several years ago, my colleagues and I at Tri-City initiated a series of conversations with both clinic systems and their doctors to introduce the concept of a laborist model that would, in simple terms, reduce or eliminate the massive financial burden that inpatient obstetric care had become to both clinics. Unfortunately, at that time, moving forward with a laborist program was not feasible because the VCC and True Care physicians didn't support it. Both clinic systems, VCC and True Care, then contracted with Palomar Health for a laborist program, terminated their physicians from providing inpatient care, and noticed Tri-City of a pending movement of deliveries to their system. What has happened since? In March of 2022, Tri-City instituted our own laborist program. Why now and not then? You simply cannot unilaterally eliminate over 15 board-certified OBGYNs and 7 midwives from our region and community without negatively impacting access to quality care. That's what's happened. But Palomar did through a backdoor deal, and now after purposely and intentionally circumventing LAFCO's authority, they asked that you be complicit in dismantling our safety net for laboring mothers. Our labor and delivery and neonatal care capabilities are as strong as ever. Our clinical outcomes are phenomenal. The quality of care is second to none. As a working ER physician, I've witnessed a recent surge in L&D bypass at Palomar Health, meaning that women in labor must go elsewhere because Palomar Health doesn't have enough capacity to care for them. I know that because many of these patients are seen now at Tri-City after they have experienced delays or difficulty accessing care at Palomar. As you can imagine, this is very concerning, but thankfully we have tremendous capacity to care for these patients despite what you're being led to believe. This also has far-reaching implications for babies, parents, paramedics, and the overall county healthcare safety net. A disproportionate share of patients outside of Palomar Health's district are now being told they are no longer permitted to access readily available high-quality care within their own neighborhoods. After decades of faithfully serving this population, this is sad to see. This situation is also impacting physicians. You should be aware there are obstetricians who have recently raised quality of care concerns at Palomar Health and who have opted to resign rather than jeopardize their commitment to their patients. Now, to justify their actions, they've artificially fabricated a non-existent healthcare crisis in our district. Let me repeat, a non-existent healthcare crisis, a fabrication, and I ask you to see through this veil of deceit. To be clear, our capabilities at Tri-City have never been stronger. Our capacity is strong, our patient outcomes are excellent, and we stand at the ready as we have for 60 years to care for the patients of our district. Thank you very much.
Thank you, Dr. Moore. And,
Can I ask a question
sure,
for clarification on that?
sure. Yeah, Dr. Given, let's take a quick question. Sure.
What is the waiver?
That's a really good question. It is an evolution of they are dedicated physicians who specialize in the delivery of babies and they stay in the hospital 24/7. So no longer is it, more and more these days, residents, trainees coming out do not want to do what traditional OBGYNs did, which is work in the practice in their offices and then go deliver babies at the same time or at night. It's a dedicated practice to staying in the hospital is what a laborist is.
So are they an employee of the hospital?
The arrangements can be different. In the cases here at Tri-City, I can speak to Tri-City's case, our laborists are contracted through a third party.
Okay,
So they're independent contractors.
okay, so what happened to the other OBGYN medical doctors?
So most of them no longer provide inpatient care in our community. Many have moved to other areas, San Diego, South San Diego. I know many of my colleagues are down here now in San Diego, but no longer deliver in North County. We lost some excellent, longstanding community physicians, which is what we were trying to not precipitate.
So this is a cost saving methodology for Florida, kind of? Thank you.
All right, thank you very much. And after we hear from the speakers, we can, if there's questions from the commissioners, we can ask as well. But if you have it right away, that's fine. Thank you,
Well, I was
Dr.
afraid they were going to be continuing using that verbiage,
Oh,
but I didn't know
yeah.
exactly what it was.
It's a whole new set of acronyms and names and labels and everything else. Yes. So Melissa Terra, and then now Rocky Chavez.
Good morning, Mr. Chair, Commissioners, LAFCO staff. My name is Melissa Terra. I'm the Director of Women and Newborn Services at Tri-City Healthcare District, and I'm a nurse of over 17 years. My goal today is to provide some insight into our capabilities and share data and experiences of those patients, both mothers and babies, who have needed care after being discharged from Palomar Health District. Tri-City is consistently recognized by Newsweek magazine's Best Maternity Hospitals list. We are recipients of numerous quality awards from the California Maternal Quality Care Collaborative. Our level 3 NICU is the largest and most capable in North County and has been for decades. The 24/7 presence of board certified neonatologists and specially trained nurses and respiratory therapists allows us to turn a preemie parent's worst nightmare into a story of triumph and survival as the team works quickly to intervene and save the newborn's life. Despite the recent redirection of our patients, we remain fully staffed, ready and willing to provide the exceptional quality and safe care that we have always provided to mothers and newborns in our community for the last 60 years. We have been quite alarmed at the number of patients over the past several months alone who have required care at Tri-City after being discharged from Palomar Health District.
For challenged stress families.
Yeah. Everybody please mute themselves if they're not speaking. Thank you.
In August of this year, of the approximately 75 moms and dads that were forced to receive care outside of our district, 30% had babies readmitted to our hospital to receive additional care for critical healthcare issues such as hyperbilirubinemia, dehydration, and weight loss, many within the first 3 days after delivery. Historically, with our patient population, including those now receiving care outside of our district, we would have readmitted nearly 2 to 4% of our patients for similar issues because of the clinical protocols and safe mom and baby discharge practices we have in place.
After caring for these newborns, what we've heard from these mothers is quite shocking. Patients who have recently returned to Tri-City have reported long wait times in OB triage and patient care being provided in hallways when seeking medical care at Palomar. Mothers expressed feeling frustrated and concerned that they are being directed out of district for care. Some have even reported being told that they had to go to Palomar because Tri-City's labor and delivery department closed down, and expressed relief when they heard that we were still continuously open. Clearly, misinformation is being spread in our communities, and that misinformation can lead to deadly consequences. For the mother who suddenly starts bleeding, a 5-minute drive and a 45-minute drive can mean the difference between the survival of both mom and baby during a placental eruption. For the mother who goes into labor at 26 weeks, timely care can lead to precious extra hours or days in utero for her unborn baby. When it comes to women and newborn care, minutes matter. At Tri-City Healthcare District, you can rest assured that we have adequate resources. We remain absolutely committed to the highest quality care and birth outcomes for our community, and we will continue to do so moving forward. Thank you.
Thank you, Melissa, appreciate it. And Rocky Chavez, it just says Rock on here. Did you get rid of the Y?
You can call me Colonel.
Okay. Okay, you're not in uniform, so we'll stick with Rocky. Thanks.
Thank you. First of all, thanks for allowing me to come talk to the board, to the members of the board and the staff. As you can tell from the discussion earlier by our members, this is a real emotional issue with us. I'm going to ask you to revisit it. I understand what the executive officer's written. I've read his report. And I understand that sometimes you have to make decisions with the best information you have, sir. And that's why we're here to provide another perspective. So what we're going to ask is hopefully a revisiting, maybe 60 days and more information come forward from all sides so that we can take a clearer look at this, because we're dealing with the issue of babies. As a lot of you know, my background, I've been involved in an Oceanside and Vista community for over 20 years in a number of positions as a council member, as a assembly member, and now as a chairman of the board at Tri-City Medical. I had the honor to be there for 4 years. And when I go around my community, I recognize the fact that we have a lot of minorities and poor communities. And we also have military. In fact, just a few weeks ago, a young military Latina had a child who had 2 children that were at risk, but because of the quality care at Tri-City, both those children were delivered safely, and the mother was able to go home to her military family and sing the praise that they received at Tri-City. This is not something that is passing with me. This is something that speaks to the core of who I am and why I do public service. When this first came through about the amount of money that it would take to continue the service, there was some discussion in the papers saying, you know, Tri-City's out of this business. That was wrong. In fact, in the article in the Union Tribune, they quoted me saying, Tri-City is here to provide this service. We've been delivering babies for 70 years. We're going to continue to do it. And I made the motion and direction to the CEO to fund that so that we would continue to do it at a cost of a couple $1 million a year. But I saw that as critical to why is Tri-City there in the first place. You know, there were some discussions earlier about in the paper that I saw that was sent around about somebody saying the quality of care. It's interesting to me that doctor who made those comments that are being cited in the papers you're seeing actually signed a contract with us a number of months ago for another 3 years to be with us. This isn't about care of children. This is about control and money. And which goes into the whole reason why is there a LAFCO? A LAFCO is there to ensure that there is an efficient governance structure either in education and water districts, fire districts, and in healthcare districts. This is clearly within your purview. I think we've shown that there is no emergency. We meet all the requirements we've had. And I would just ask the board members to take an opportunity to follow in what your director has said. And his recommendation said to provide OGBI medical services outside his boundary of sphere of influence are described and provide direction to the executive officer as needed. I'd ask you to provide the direction to him to go to a 60-day review and look at this. I prefer you just drop it. But having been involved, like I mentioned earlier, for 20 years of government, sometimes we make decisions with the information we have, and I want to be respectful to the executive officer. So please, board, give direction to revisit this, a 60-day stay, and then we can go for it. Thank you very much for allowing me to address the board.
Thank you, Roger. Appreciate it, Colonel. So that's all of the speakers' requests we have right now. We have no others. Do we have anybody online? No. Okay. Well, this one really kind of tears me up because these are both hospitals in my district. And to see, accusations flying back and forth. Instead, we should be, okay, if some, I'm not saying anyone is, but if somebody's deficit in some area, we should have a hospital working together and helping each other out. Instead of coming here and doing this. And I wish we had better relationships between the two hospitals so that they're not pointing fingers at each other. And nobody's perfect on either side, but we should be helping each other instead of throwing rocks. So I do appreciate and respect Keen's judgment. If there was an error at all, he erred on the side of safety, which is fine. And I think I respect you for that. However, I have many concerns. I'll get my other board members speak here in a little bit, but I have many concerns. In particular, the fact that contracts were actually signed almost a year ago with Vista Community Clinic and Palomar Health. And I think it took effect October 16th of last year. And then in June, we get the request for the extending of services beyond their boundaries when it was already codified in a contract. And our own code says that a city or district may provide new or extended services by contract or agreement outside its jurisdictional boundary only if it first requests and receives approval from the commission in the county, which is basically LAFCO. It could have come here, and I'm not just pointing fingers at Palomar Health for doing that. I talked to Diane Hansen. She said she wasn't aware that they had to go through that. They knew they had to go through that for brick and mortar, but not for contracts. But it explicitly says contracts in our code. So so I don't know when the emergency really kind of took place, because if they signed the contracts with Vista Community Clinic in October it took effect, and then also with True Care in March of this year, is the health issue over or not? And I think what it really comes down to for us here is, we got to make sure the health and safety of the patients and mothers and children and delivered babies. And in North County, we're working cohesively to make that happen, as opposed to throwing rocks again. So I think that's our first concern: make sure that the services are being provided on both sides. But then I think secondary, with our LAFCO hats on, we got to protect our boundaries, and our boundaries have to be made whole. They can't be Swiss cheese. They can't be having agreements and contracts being done. And I would have asked Tri-City when these contracts took place to start jumping up and down then and said, hey, we should have, let LAFCO know. And you're right, they should have came to LAFCO in the first place. So I'm trying to evenly spread the responsibility. Thank you. That's a better word than I had. So I too would think that revisiting this is good, because Tina, I respect you didn't have a lot of time. You made the right decision, I think. But I think we should revisit this approval to see if the public health threat is still in place. And if it's not, then we got to make our districts whole. We need an off-ramp. We need and I don't think the 3 years the contracts, I think we need to do it sooner rather than later. But we need to have, okay, this has been done, this is where we are today. We revisit it, and when the emergency's over, if it is, when we deem it's no longer needed, we need an off-ramp to get our a cure for the districts and the boundaries to be made whole sooner rather than later. So that's, I'll make a motion that I'll just put it out there for discussion and we can have more board input. But like I said, it's just tears me up that we're not collaborating. And we could and we should be, and I want to see us move to that. I'd be happy to facilitate meetings between Tri-City Power Health in the future, that we can sit down in a room and say, okay, how do we make this work as opposed to what's going on. So thank you very much. Stop my rant, but this is near and dear. Mayor Salas.
Yeah, I have several questions. In the letter that was drafted by Keene to Palmer Health Care District, where it gives a notice of the conditional approval. In the letter, it states that according to Mr. Keene's review, not Mr. Keene, Mr. Simon's review, is that that he concluded that there was sufficient evidence to substantiate the claim of a threat to public health. But in all the reading that I have seen here in this report, I don't see the findings of fact. I don't see where we received the information, where the threat to public safety and health was. And if you could provide me with that, I'd be a lot more comfortable with your recommendation.
Very good. So two things, Commissioner Salas. As the delegated officer, the application went through me, and so there was application materials that I reviewed that are not part of this packet. This packet instead is me fulfilling my policy duty to say this is what I did and provide feedback. Obviously, I can transmit those application materials to the entire commission so you can see where I drew my decision making from. And I guess as a broader comment, the two clinics, and I believe that they are actually on phones and they'd like to communicate with the commission as part of the testimony process, provided LAFCO staff, and it's further illuminated in these supplemental correspondence letters that you have, that they financially felt they were in an unreliable situation with Tri-City, and it was going down the path where they needed to make a business decision because their clients, their customers were no longer receiving reliable and safe medical care. These two clinics were specific to True Care and Vista Community Clinic. And so based on that connection, that a part of providing a reliable municipal service is having the funds to do it, I authorized the outside service extension for Palomar specific to these clinic sites in Oceanside and Vista.
Okay, so I'm not understanding, cost is one thing, but public safety and safety and health is another thing. And I don't think that you could combine the two to make a decision. I think they have to be separate. Because no matter what, sure, we want to reduce the cost and bring it down. But if it's a matter of how much they're billed, the consumer is billed, or how much a clinic is reimbursed, that's a different issue than, I think, public safety and health. So that part of the financial argument, I would set aside and make a different determination not related to the healthcare services, right? But then I have questions both to Palomar and to Tri-City as well. So
Commissioner Salas, and I apologize to do this, but it's such a critical point of I think where you're going. I want to just reemphasize that in making my determination based on those comments, that there appears to be a financial concern that is undercutting the reliability and safety of service, That's me deferring to the clinic's stated comments. They're the experts providing service to their clients, and they're coming out and telling LAFCO, we've got a problem, and these service arrangement with Palomar would help steady the ship. So I apologize for interrupting.
And I'm just gonna, we have a process to come to LAFCO and let us know, and maybe we can work something out. You don't just sign a contract with somebody out of district. It's kind of, I'm sorry, Mary slipped this.
Yeah,
Are you-
so, no, I'm not done.
Yeah. Sure.
Because there's a lot of nuances to this. It's more than just the face of the report, right? So the fact that the model of the laborist is that something that, this is for Palomar, is that a new model, or is that something that you've had for a long time? And then why did you go to that laborist model rather than the traditional model of the OBGYN delivering the services? And I guess I can understand. You're not having to wait for that doctor to come for the delivery, right? So, it's good to see this.
Good morning, Commissioners. My name is Kristen Gaspar. Happy to be here on behalf of Palomar Health today. The best person to answer this question specifically is your CEO of VCC, is actually on the line this morning, and he can address historically a big piece of the puzzle that's missing in the conversation today about why VCC came to Palomar. If I can impart one thing upon you today, you need to understand that Palomar didn't go seeking out these patients in Tri-City Healthcare's district. A problem came up, years of VCC trying to come to a solution with Tri-City Healthcare, unable to come to a plan of action with Tri-City, and that's when they came to Palomar. So we did not approach VCC, rather VCC approached us. And we felt as though it was very important to take this issue seriously, especially considering that these are mothers by and large. And these are also mostly Medi-Cal patients, so an underserved population that we were talking about a year ago. As mentioned briefly by Supervisor Desmond, the CEO, Diane Hansen, acknowledges that there was a misstep, that we needed to come to you, but we were unaware that we needed to come to you on a contract negotiation. It was our understanding that brick and mortar, absolutely, and we've come before this body before. So as soon as we learned that there was an issue with contract services needing review by your board, we respectfully submitted our application with you within days of learning that that was a recommended action. So please accept our sincere apology for not knowing about the contract portion. And also please understand that we'd love to work with Tri-City on this issue and many other issues in the region. One thing that was really beautiful during the pandemic was watching the 22 area hospitals come together and really flex and act as one healthcare system. But we're often in the dark when it comes to dealing with Tri-City. You saw this with the closure of the behavioral health portion of Tri-City. Those patients immediately come to Palomar. It's a fragile ecosystem. So in this case, trying to be proactive, recognizing that there was a need. So at this point, I would love to ask if we could have Fernando from BCC address the board. He did submit a letter to you that addressed how it came to be that we ended up contracting the services with BCC, but I'd love for you to hear it from his own mouth and his own words.
Thank you, former Supervisor Kristen Gaspar. Thank you. I've got it. We have the clinics on the line. I also have a couple board members that have further questions. Paul, did you want to, Ms. McNamara, did you want to say something before we go to the clinics?
Yes, if you don't mind, Chair, because hopefully the clinics will maybe answer some of my questions. Obviously, I think we all believe that healthcare is important and a priority, especially when we're dealing with babies. But at the same time, the harsh reality, as I think Rocky pointed out, it is a business and it is about money. My understanding is the OBGYN field has had difficulty in comparison to other branches of healthcare making money. And so my first question is the laborist concept, is that a new concept based on a more efficient way to provide OBGYN services. Okay, that would be my first question. As opposed to the traditional, you go to your OBGYN doctor who belongs to some hospital, and then you eventually would have the baby delivered in that hospital. The second is, I'd really like to know a lot more. I mean, obviously, when Tri-City went to those laborists, it seems to me, and I don't know for certain, that Vista Community Clinic and True Care were unable to financially maintain a relationship with Tri-City Medical Center. And based on that, I support our executive officer's decision. I probably would have made the same one. But I also agree with Chair Desmond that, when it comes to healthcare, we would expect you guys to be talking a little bit more than bringing it here. I feel like we're Solomon with the baby right now. That's up to you, Jim. So when we hear from VCC and True Care, or really anyone else, I would ask you to address the points that I brought up and see if you can give me a little bit more clarification. Thank you.
Commissioner McKenzie, chance, and then we'll go to the clinics.
Thank you, Chair. Comment that our executive officer brought up is that he had additional information than what we have. And in the staff report, it indicated that they had what the issues were that precipitated his decision to approve this out of area contract. And I think we don't have all the information at this point in time to say, okay, I have no idea what points other than monetary were the issues of Tri-Care or the Tri-City and the True Care Clinic. And their application is basically name, address, and telephone number. There's no other additional information, and I don't see anywhere where they did fill out the policy L107 form. And there's nothing here as why is the service needed? That's number 2. That's blank. There's no addendum at least attached to this report. And I would agree with Tri-City. Let's come back and revisit this in 30 to 60 days. And then my second question to the EO is this in perpetuity, or once the emergency and health and safety can be rectified or eliminated because Tri-City now has the same services and the ability that Palomar has? Does that go away at some point in time, or is this until that goes part?
Through the chair, my approval has no term on it.
So once the emergency is perceived to be non-existent, there's still the contract still.
That's as it is currently issued, yes. Perhaps that is one of the things we will revisit.
We as a commission will, after I guess we hear from everybody, we'll probably discuss that. And I will go to the True Care and VCC, who I'm not, I don't think any blame was there at all. Money is, you got to provide services and you need money to do it. And so you want to do that, but there's a mechanism to remedy that. And that's come to LAFCO and tell us, get the approval, and we can make it, it's justifiable, make it happen. It's kind of tough when contracts have already been signed. But anyway, we'll let them defend themselves here. First of all, I guess from Vista Community Clinic, is it Fernando Sanuda? Are you on?
Yes, can you hear me?
Yes, please go ahead. Thanks, Fernando.
Yes, so this is Fernando Sanudo. I'm the CEO for Vista Community Clinic. And I apologize ahead of time. I could hear most of you, but there's a couple folks that have been speaking that I have a really tough time hearing. So if you can take that into consideration. Anyway, the decision to transfer our pregnant moms for delivery to Palomar Health has been it's been a long time coming. Vista Community Clinic has always had a very good relationship with Tri-City. In fact, I still do have a very good relationship with them. They currently see all of our adult patients that require hospitalization. We have a contract with Tri-City to follow up on patients that are hospitalized to make sure that they come in a timely manner to be reassessed so that they don't end up in the hospital again. Unfortunately, the issue with our OB program has been an ongoing issue for over a decade, where we were losing a lot of money as a result of having to pay doctors to be on call 24/7, 365 days out of the year. And it wasn't just the cost of our doctors. We were also having to pay a surgical assist group because whenever our doctors did a C-section, they were required to have a surgical assist. So we were contracting with a group of physician assistants or surgical physician assistants that we were paying to provide that service as well. And so you can imagine it was very costly. We were losing a lot of money. I was having conversations with my board. They were aware of this. However, it was a service, delivery service that we wanted to continue to provide to our patients. I've been having conversations with Tri-City for a long time in regards to, is there anything we could be doing differently to somewhat offset the costs and the expenses that we were taking on as a result of this, agreement that we had for our doctors to provide deliveries there at Tri-City. Tri-City, my understanding, was not in a position financially to assist us. And in fact, Tri-City made it known to me and to several of my doctors and my CMO at the time that whenever one of our Medi-Cal patients delivered at Tri-City and had to spend the night, that the hospital was losing $1,000 a day in order to hospitalize any of our patients. So I kind of interpret that as, we're already providing you basically assistance by accruing the expense of having these patients spend the night at the hospital. So I would say that I was having conversations with Tri-City for quite a bit of time. In fact, when I became CEO of Vista Community Clinic back in January of 2013, one of the first things that I did was to meet with TrueCare. At the time, it was North County Health Services, and Irma Cota was the executive director. They were having the same financial situation as well. So Irma and I had actually gone to the hospital to meet to see if we could come to some sort of an agreement to, again, try to offset some of our expenses. Nothing really became of that meeting, and so Irma and I continued to have conversations, and we just couldn't come up with a plan that would work for both of us. So back in early, I guess it was 2021 or maybe late 2020, Tri-City had reached out to me that they were looking at hiring a laborist group that could provide delivery services. And if I was asked if I would be open to basically contracting Tri-City to do our deliveries so that we wouldn't necessarily have to hire or keep our OBs from delivering services there at the hospital and accruing the the expense that we were accruing. And so we had numerous conversations with Tri-City, and I was actually very excited to be able to move into this different contract that would offset my expenses because Tri-City would be paying for the laborist group, and our job was basically to send our patients there for deliveries. And so these conversations happen over time. And I believe we even had a Zoom call where they introduced me to OBHG, which was the laborist group that Tri-City was considering. We had a conversation with them, and I thought it went really well. However, I was told that in order for OBHG to be successful, that they were going to need to employ some of my doctors because they didn't have enough OBs to be able to do all of the deliveries for Vista, Troop Care, and then the deliveries from the community dogs. And so I understand that some of my doctors were approached about the possibility of working with OBHG. And I mean, I wasn't present for those conversations. However, what I've heard back from Tri-City that our doctors were not interested in working with OBHG because they liked the model that we had in Vista. And again, that was a model that we just couldn't continue to sustain. So when I heard from Tri-City that OBHG, the laborist group, was also entertaining offers by Palomar to basically do the same thing that they were looking to do at Tri-City, I then meaning Fernando, approached Palomar, and I reached out to them and to tell them that I had heard that OBHG was looking to contract with them, and I wanted to know if they would be interested in generating a contract with us to take over our deliveries. And so many conversations ensued after I initially approached Palomar, but at the same time, I was also having the conversations at Tri-City and letting them know, look, I'm having these conversations with Palomar, and it looks like they're going to hire OBHG, which means that we're going to be taking our delivery elsewhere. And so the conversations were, okay, well, right now we personally cannot afford to hire OBHG. So in that respect, if you stay with Tri-City, you'll have to continue with the current model that you have, which, you know, we couldn't sustain financially anymore. And so I
guess some of the points that are being made here, and we get it, that it was, I'm hearing from you, it's a lot of financial. Was there ever a health risk to any of your patients at Tri-City?
No.
Okay.
No, it was, the decision was truly financial. I mean, our doctors were doing our delivery.
We worked through that, and I don't know that we're going to be able to solve that today, but that seems to be the issue that needs to be remedied so that in North County we can get all the, as much care as possible and work that out. Is what it appears. So, and is there anything you just want to say real quick to wrap it up? Because we also got to get care.
Yeah. So basically, in a nutshell, I approached Palomar. We developed a contract. I informed Tri-City. I gave them the amount of time of notice that they needed to have. They accepted it. I soon got a call from Steve Dietland, basically asking me if I could give them more time because they were going to need to hire some OBs just in case they needed some OBs at the hospital. At that time, I told them that I apologized. I couldn't give them more time because we had already signed the contract and we needed to move forward. And that was basically the discussion.
Okay. All right. Thank you. Thank you very much. Appreciate all your input and history and appreciate all you're trying to do. And I know Vista Community Clinic, you're trying to provide the best service you can with the dollars you have. So thank you for that.
Sorry, can I just say one more thing because this came up earlier. So far, so it's been a year now, almost a year that we've been at Palomar, and as I told Steve last week, we haven't heard any issues from our patients. In fact, all our patients have been very happy with the services. We were concerned about the drive to Escondido. We were prepared to have a van available to transport them if they needed it. That has not come up. So as far as we're concerned, everything has been working out well. There hasn't been any concerns on our parts or any concern on the patient parts either. So I just wanted to state that too.
You're happy. All right, thank you. And then Michelle Gonzalez from TrueCare, are you on the line?
I am. Hi, good morning, everyone. Michelle Gonzalez, President and CEO with TrueCare. Thank you all for allowing me some time on the floor. I understand you're pressed for time, and I will refrain from trying to be too repetitive in terms of some of the things that my colleague Fernando covered. I want to just first start by stating that we have had a very excellent and worthwhile partnership with Tri-City, and we still do, similar to VCC. And we applaud all of the years that we have worked with them and all of the babies that we've been able to deliver and the fantastic outcomes that we have achieved together. However, that doesn't negate the fact that for several years, TrueCare, formerly North County Health Services, was losing anywhere between $2 to $2.5 million annually as a result of the additional coverage that we had to self-fund. Our model is unique compared to VCC's and many of the other community health centers, and that for many years, we were the last standing health center to offer a midwifery model. And what that essentially meant is that we had to provide backup coverage for all of our midwives. And so it was double the price in terms of what we were having to pay. This model, however, was also very beneficial for Tri-City, again, as I mentioned, in terms of achieving some very successful outcomes. For several years, my predecessors had tried to work with Tri-City in addition to VCC to explore alternative models that we could deploy to cut down on the costs and still retain the excellent partnership as well as the sound outcomes that we were achieving. But to no avail, that could not be achieved. For the committee's awareness, I did come into my role in the early part of 2020 after I was filling in as interim CEO. And from the moment I hit the ground, this was a very hot topic of conversation and something that we knew, as well as my board, that we needed to mitigate. So for an extended period of time, we were working with Tri-City and their administration. I will also say that it's important to note that our patients are not just in Tri-City's district. We have patients that come from San Marcos and as rural as Ramona and Julian. So we really are a part of Palomar's district as well. And we were doing everything that we could to try and find an alternative that would allow us to work with both hospitals. However, when the time came to step up and really solidify a partnership with a hospitalist program, it was Palomar that stepped into that role. And really, as Fernando had described, only after we had approached them. I also want to say that the question came up earlier about were patients ever at risk? And so for TrueCare, I can unequivocally say, yes, they were. As you all are aware, it's incredibly difficult to fill many of the positions related to our OBs and various providers. And that only was exacerbated after the pandemic. As I described, because we had to fulfill double the coverage, we were finding ourselves not only contending with a huge loss, but now also a shortage in terms of being able to secure coverage for our patients. And so what we found was that we really needed to try and move swiftly and really come to terms with a new type of model and program. And that really required Tri-City to step up and step in with a hospitalist program. That did not come to fruition, as I described. Even after VCC had departed, we went back to Tri-City and said, let's try to figure this out. We don't want to have to transition our patients necessarily. But even after several months, that did not come to fruition. And so as a result, we were forced to pursue this other alternative. And I really want to applaud Palomar for stepping up and stepping in and offering the clinic something else. Otherwise, our patients would have very much been left in the lurch.
Well, thank you, Michelle. So you say, I guess what I understood is that your patients were at risk and primarily because of the extra costs and extra burden that was put on you and you were having to pay at Palomar there, therefore you could provide fewer services. Is that pretty much it?
Correct.
Okay.
Without a reliable, high quality hospitalist model, we did not have adequate coverage given the situation that we were in previously. And again, that doesn't negate from the outstanding care and quality that we received over the years from Tri-City. But when coverage became too difficult to maintain. We really were forced with no other alternative.
Okay. All right. Well, thank you very much, Michelle. Appreciate yours and Fernando's input, everybody's input. Do we have, I know Keen wants to say a couple words. Do we have anybody online or any comments? No? I don't see any other commissioner comments. Do you have any, Barry?
What I'm hearing is that this is more of a financial crisis. And so I was just wondering that if you started to say that we should have it reviewed, but what would be a reasonable day, number of days of review on this?
Well, I think I made a motion, I think if I can remember it, to let's see, I got scribbles everywhere, but to review or revisit the approval and come back within 60 days, let us know if this public health threat is over. And then I guess and number one, we want to make sure all patients are getting the care they need, but we also have to respect our boundaries. And if these financial, I do think these financial, that's sort of the end of the motion, is this, we revisit it, come back in 60 days and provide an off-ramp and a cure to make the districts whole.
Second.
That's it. Okay.
We didn't have a second.
Oh, you have a second. Okay, we have a second. Okay, and the third.
I just wanted to add one more
Okay.
thing. So I started out the discussion with saying that, a financial emergency isn't necessarily a health emergency, but there is a nexus, and that's the emergency could be that a clinic goes out of business and then you have nothing. So, that's the other part of it. So, even though, I still think we should have gotten the information, at hand to back us, to give us that, but I can see the nexus between the two.
And I agree with you, there is, but I wish we'd have handled this differently or came to us differently. And as county supervisor, I'm willing to work with you. Both hospitals and the clinics as well. We want to make sure they're all successful. They're all great people. I remember Umakota from the neighborhood, I can't remember the name now, but pardon me?
North County Health.
North County Health Service, great services everybody provides, and sometimes hospitals, just like any other large entity, they're not as nimble on their feet as maybe they'd like to be or can be. And I think if we can work through these issues, so I guess so. I'll leave my motion to revisit, try to make it with a cure to make our districts whole. And then if there's issues where, if North County True Care can come to us with a case that we absolutely have to go to this other provider because of Tri-City, we can't afford it, then come to the LAFCO board and we can discuss that issue and then move forward. It's more how this was presented or came to us. Anybody else have any comments?
Mr. Chair? Andy,
Yes.
Yeah, it seems like this thing has been brewing for a long time. I give Keen a lot of credit for stepping out, making this bold decision with the decision that he made. It seems like we're getting into a rock throwing contest right now, and we really the district should be supporting each other. So I would support the 60-day review, providing our major goal is to find solutions, not fault, and to look at the major funding issue, which seems to be the core issue here. So who knows, perhaps we could make peace with the two districts and also find some additional funding. But I think enough has been exposed today. There's a lot out there when you start talking about another hospital and their lack of performance. That's pretty crucial for reputation. So once again, I'd support the 60-day review with certain guidelines.
Thank you. Thank you, Andy. Before we vote, Keem, do you have a couple comments?
Well, first of all, I want to extend my appreciation to all the speakers and the commission for your thoughtful input. Obviously, this was a unique process and request for LAFCO. So just very quickly, I certainly appreciate Commissioners McNamara and Salas for hitting upon the issue that you can't extract costs from health and safety considerations at LAFCO, and this is for the benefit of context. 6 times a year, you get requests from landowners who have a well that's gone dry or a septic that has gone bad. It's not our practice to tell that landowner, take a credit card and drill deeper or replace your septic system. So staff has an orientation towards this problem solving. For a question for the chair as the maker of the motion and Commissioner McKenzie as the second, am I to understand that you would like staff to revisit this, my determination no later than in 60 days and provide an update to the commission? That would be consistent with your policies. You delegated this decision-making to me. I just want to make sure that it is still for me to address and provide a report to the commission and receive feedback accordingly.
Well, and to make the motion, also to include options for remedies to make our districts whole. Again, I think that's the long-term effect, and so I want to make sure that's in there as well. Yeah, Commissioner McKenzie, then we'll get to this.
I would like to see an analysis of the emergency. The emergency as, or not, the Tri-City sees, the emergency that True Care, Vista Clinic and Palomar see. Because what I'm hearing is, it sounds like today, the emergency that was may not be. And that's why I supported the coming back in 60 days and really looking at what is today. Because it could well have been, satisfied by now. And in 60 days, they may definitely. But also within these agreements, there's also a requirement that the two clinics backfill any shortfall that Palomar has in their income. That's what's redacted. So, it's.
All right.
I support coming back in 60 days.
Okay, Mayor McNamara.
Quick question. So we'll have to come back and either approve or disapprove Palomar's application to do stuff outside of their district.
The authority remains with the executive officer.
Okay. So
I will give you an update as to whether I've turned it or continued it for reasons and the analysis provided.
Thank you.
So, Jim, one of the things I hope comes from this is that I feel hopefully Palomar will develop a closer relationship with LAFCO so they don't wait so long. They come to us sooner when something like this comes up again and they're starting to drive the boundary. So I hope this is something that comes out of this.
Just because it's a point worth making, yes, Palomar should have come to LAFCO sooner, but I could say that about a lot of agencies. Our Q rating's not the highest, and so when they were made aware of the connection with LAFCO, I have to say they have been dutiful, as Kristen Gaspar mentioned, in working with staff once they became aware.
And then I guess with your decision, I have the question, does it acknowledge, ratify, or accept the contracts that were brought into play earlier with Palomar and Vista Community Health and True Care, or are those still, this body never heard them, so I just wanted to make sure we're not tying ourselves to these contracts that we had no input or action on.
The executive officer's approval is specific to the service provider clinics, not the contracts.
Okay, I just want to make sure that was clear. Okay, I'm seeing some hands waving back here. Rocky, what do you got real quick? Mr. Brown, if you want to speak, you can put in a speaker slip.
Just a question, just from the report that was given in response to the executive officer, his report says, the commission remains the ultimate authority and may provide directions to revisit, to amend, or terminate the approval. So there's three options there for which which was asked.
Motion's
He's trying to highlight his own words.
Motion's revisited. Okay. Mr. Brown.
I'll fill out speakers.
Okay.
Chris Brown. Just a quick question, Mr. Chair. What does make whole mean? We're throwing that around and you made that comment several times.
Well,
on the record, I'd like to know what that means.
that our boundaries are respected and that our boundaries, that we have boundaries, we don't have people doing contracts outside of the boundaries in the future, and so that entities understand that. And so moving forward, we don't have this same type of issue.
You can take it another way too, that's why I asked.
Thank you very much. Okay. Okay, we have a motion and a second. We have a roll call, please.
Yes. Commissioner Desmond,
Aye.
Commissioner Vanderland,
Yes.
Commissioner McNamara,
Aye.
Commissioner McKenzie. Aye. Commissioner Willis.
Aye.
Commissioner Salas.
Aye.
Commissioner Anderson is absent. Commissioner Kate is absent. So 6 in favor, 0 opposed, with 2 absent. The motion passes.
All right, thank you, Tammy. Well, thanks everybody for coming. I know it's a tough subject and hopefully we'll get through it and work together on solutions. Thank you. Okay, all right, moving on to 7B. This is a strategy for conducting, using municipal service reviews.
I do have a staff report and almost guaranteed this will be shorter than the last item. So on behalf of Priscilla Allen, or Priscilla Mumpower, who unfortunately had a scheduling conflict today and couldn't make it to our meeting, what you have before you is a proposed update to our policies here at LAFCO with respect to conducting municipal service reviews. A policy that has been in play for almost 20 years. It was established in 2003. I believe Commissioner Vanderland was on the commission as well as Commissioner Mathis, so they may recall the discussion back at the day. But keep in mind, MSRs, municipal service reviews, became something on our radar just a year earlier, 2002. And so the existing policy reflects that newness and spends quite a bit of energy outlining procedures and processes to, at the time, help the commission and the public get a hold on what this service review process was all about. Okay, so that's the baseline. Well, now fast forward 20 years, we have a lot of practice under our belt and hopefully best practices in mind. And so the version that you have before you, this draft update, takes a pivot, and I think appropriately so, and amends your policies to no longer focus in on the mechanics of how municipal service reviews are prepared, but rather what are the commission's big goals and policies when it comes to using service reviews. So on the screen, well, maybe not. Maybe Dude's going to isolate me for a second. Hopefully, you'll see some key revisions because my memory is not as good as it should be due. But on the screen, we've come up with a handful of revisions that reflect this pivot from procedures and processes to outcomes and goals. And in particular, we want the commission to make a couple of defining premising comments. One is that you're going to tell the world, the local agencies and the public, that the service review is going to have these 3 key functions. You're going to use it to inform sphere of influence updates, which, by the way, is somewhat opposite to how we started back in 2003, where we actually used the sphere update to determine if we were going to do an MSR. So we're flipping the switch, and I think appropriately so. We're also going to be very clear that the MSR has this 5-year window, and that if an applicant wants to come forward with a proposal that necessitates a sphere change, and we go back and we see that the last MSR for that affected area or agency is more than 5 years old, well, guess what? Either they're going to have to wait till we get to our next update, or they're going to have to fund their own MSR. So those are some broad strokes. Also, in keeping with this idea of letting the commission focus in on outcomes and policies, we've stripped away the existing language that the commission prescribes about the scope and scale of an MSR. And instead, you just have a kind of an encompassing statement saying, we delegate the EO to determine, as appropriate, the scope and scale of an MSR and all the mechanics that go into it. And I think appropriately so, be happy to get into some details. And then last but not least, Community engagement has been a topic that was not on the radar in 2003 when we were doing the first round of MSRs. Obviously, the world's changed. So one of the key features of this revision is to not only acknowledge community engagement, but you establishing some baseline expectations for the executive officer plus some options, whether it be holding workshops or surveys, but you put some emphasis and of course, when we get to budget, funding as needed for these kind of tools. So this is being presented to you today for first impressions. Would love any comments that you may have on it. If you believe that the draft is sufficient to go on to the next phase, we would like to go and issue a formal public review. We're going to go to our city and special district advisory committees at the end of this month with this version, plus with whatever suggestions you may have. And then hopefully we'll come back in December with a final version for you to take up. So that's my overview on behalf of staff. If you have any questions and in particular any feedback, love to hear it.
Mr. Chair?
Yes, go ahead.
Keen, correct me if I'm wrong, but what I don't see in municipal service reviews in general are quantitative measurements. I think things like ISO standards for fire protection or response times for EMTs or anything like contamination of water or quality of service. How well is the government actually providing these services of the review? Am I missing that? And also even the financial report. When we go through some of these agencies, it's a question of how healthy are they financially when they're done?
Yeah.
Am I off track here?
Well, I would say that the MSRs San Diego LAFCO is producing are quantitative in many respects, certainly financially, and then we work as best we can with the affected agencies in developing performance measurements. Performance measurements and the emphasis on quantifying demands is not part of this draft proposal. And instead, it's part of that overall policy comment that you hire the EO hires staff, and that you're just going to delegate the process of creating an MSR. And certainly if we're doing our job, we're checking in with you through draft and final versions to make sure that the scope is appropriate. But we don't think it's not necessarily appropriate to put in a policy, because then we're stuck to following a policy when local conditions suggest we really should be looking at something else.
One of the consequences is that insurers are starting to drop fire protection for high risk areas. And there are other consequences of that, not just fire, but others. Because if we don't watch what's happening in terms of our public service protection, the insurers are watching.
All right, well said. Good comments. Mr. Chair, Commissioner Drake, Commissioner McKenzie.
Do we have a dollar figure on this? Or is this just a draft?
So this draft, there's no budget number to updating the MSR. It's already something that's in the books. We're just updating, if I'm understanding the question.
Well, you're asking them to update the MSR review policy 11-106.
Oh, so
Cost. Is there a cost to this?
no. And I guess I might not be understanding the question. A cost to updating the policy?
Well, let's see. Is this the one?
Or do you mean a cost for the
Wait a minute,
itself?
I'm sorry, I'm on the wrong one. Never mind.
Well, good
I'm
deal.
going ahead.
Good idea.
Sorry about that.
Yeah. I'm being
I'm
concerned about the
I'm
cost.
trying to move you along.
That was
that's
good.
all.
Okay. Well,
I'll
that
ask my
didn't work.
question next
Joe.
time.
All right. Okay, is this an action item we need to vote on?
It's not action.
It's not an action. Okay, just a report. Okay, thank you very much. Do we have any other comments or feedback? Is Andy on the line? Does he have anything? No, I think we're good. Okay. Thank you very much. 7C, this is an actionable item, authorization to enter an agreement for the advisory human resources support with Regional Government Services Authority. Outstanding. I'm just going to check in with staff if we have Bobby Bennett available with Regional Government Services, just in case there are any questions. But nevertheless, as some of the more tenured members of the commission will recall, a few years ago, right before the pandemic, a discussion came up on the dais about
establishing some support human resources for your executive officer. Then that darn pandemic happened and we got distracted. Well, anyway, we're now back to the topic. And so before you, Commission, is a contract that I'm seeking your authorization to sign that would allow us to use RGS, Regional Government Services, they're a JPA, and use them kind of as a la carte for advisory human resources support as needed in particular, and probably right away, help your executive officer with just ongoing employee relations. And then ideally, perhaps as early as next fiscal year, if we budgeted, do a comprehensive policy update to our personnel policies. As the commissioners know, we are a child removed from the county STEM system. And beginning in 1995, we all became commission employees. And from that point forward, the county slowly and gradually withdrew general HR support service. So right now, the only HR services we get from the county are payroll and benefits administration. Everything else is left up to your executive officer and our policies. And of course, our policies date from when we were in the county. So I assure you, not that we have any employee challenges, but if we did, I would hate to have to follow the county civil service procedures.
Why not?
They're a bit tough for an 8-person organization. So
Because his salary is predicated on what they.
well, no need to bring up salaries at this point. So what I'm asking the commission is your authorization to sign a 2-year agreement with RGS for a do not exceed amount of $100,000. There would be no budget impact this fiscal year because we would simply draw on consultant costs already budget. But if we did a policy update, as I anticipate next year, I would come and ask for a budget allocation for that. So do we have Bobby available? Just want to make sure she's online or on the phone.
I did not see her.
Okay, we may have waited her out a little long, but nevertheless, this is for the commission action, and I certainly would appreciate it.
So quick question, Keen, I'm sorry. Okay, so at this point, this is just on a contractual basis, what we need as needed. Going
Yes.
forward. Okay, so next year, you're saying that we would have more definitive budget figures on this and how much?
If we did a big project like a personnel policy update, yes.
Commissioner Drake.
That's just a question. On page 2, the last item is risk management. What's the scope of work of that line item?
Is that your the scope of work on risk management, well, whether it's risk management or any of them, any of the other fields, they have given us a contract number where depending on the person, it's $120 to $200 staff hours. So that's how it will be billed. Depending on the person and their background, we'd be billed $120 to $200 on an hourly basis.
Understand, what's the deliverable?
Well, for our risk management,
Yes.
well, I can think of a number of things ranging from making sure that our literal insurance is up to date and qualified to trainings and other liability, liability protections.
But where does our liability insurance come from?
Right now, it's through a third-party Alliant, ALLIENT.
Oh, well, okay.
But you're hitting on a topic. So being the planner, human resources and risk management is not one of my go-to knowledge bases. So my pausing and answering perhaps helps illuminate why the contract would be helpful.
Just to make a comment that often employee practice insurance and claims are the largest ones you ever have to pay. So do these guys help mitigate that kind of claim?
I would hope. That's why we're bringing in someone to advise.
Hang on, hang on a second. Commissioner McKenzie had her hand on. That's right.
Yeah, I'd like to make a motion that we
Second.
our CEO to enter into an agreement for advisory human resources and a revision of our policies. Along with those policies being able to be searchable
So how big of a lift is review of our policies? That's,
It's big enough where we would come back to you with an amendment to the work plan and you have a chance to kind of go through the details before signing off.
okay, all right, all right.
Policy is going to be months down the road.
So we have a motion by Commissioner McKenzie. Was that a second by Mr. Willis? Do you have anything else, Mr. Willis? You want to?
I was trying to go to the motion first.
That's all right. Okay. Okay, I don't see any other comments online. This one, we got to vote on. So Tammy, could you call a roll call, please?
Sure. Commissioner Salas?
Yes.
Commissioner Willis?
Yes.
Commissioner McKenzie?
Yes.
Commissioner McNamara?
Yes.
Commissioner Kate is absent. Commissioner Anderson is absent. Commissioner Vanderlin?
Yes.
Commissioner Desmond?
Yes.
Have 6 in favor, 0 opposed.
You missed me somehow. Did someone vote for me? Commissioner Willis is aye.
2 absent, the motion passes.
All right, thank you very much, Tammy. I'm sure I have notes somewhere and I can't find them. What do I need to do now? Adjourn the meeting?
It's almost executive officer report. I just have 2 quick things. One is all the commissioners here, and for those virtually attending, we will send an email very quickly, have an updated timeline on our Fallbrook Rainbow detachment applications prepared by our consultant, Adam Wilson. This has been worked out with the subject agencies, and the key comment is we anticipate bringing a final report for you to start your deliberations, probably over more than one meeting, in February of 2023. And then separately, I did just want to put this on the radar. In December, we are to set our new calendar. One of the things that the state of California has changed is the starting times for public schools, which is creating a bit of a challenge for some of your employees and even your attendees to these meetings. Schools now do not open until 8:30. There's restrictions on early drop-offs. Not many of us necessarily live downtown San Diego. So we may seek out through a doodle poll or whatnot if there's some leeway in starting a little later on a Monday. I appreciate some are already giving me a look that suggests they're not wild about that, but if we would like to explore the options, so it's an FYI. Thank you, Jared.
A little later.
I'm thinking 30 minutes.
That might be better traffic at that time. I don't know. All right, we'll talk about that later. Okay. Any other commissioners have any announcements or meetings they've been to? Joe, do you have one?
Yes, I attended one meeting and one webinar. Chaired the Zoom meeting for the LAFCO Elections Committee. We went over the policies and had an extended discussion on what the difference was between a resume and the election form and the nomination form. So we got that settled. We're going to be tweaking that particular policy so it's clearer. And the problem was that there's 2 forms. One is a nomination form that all of it is stamped, little square, and the other one is one that asks questions of, name, address, telephone number, who you are, what your involvement is with LAFCO, with other governmental agencies, etc. So that has been taken care of because the CEO found the missing candidate resume form in her junk mail, which was in, because we had said, hey, it's got a nomination form, they can do whatever they want with Congress. Yeah, the absentee ballots should have gone out Sunday afternoon. Today at the latest, I will be voting member for San Diego LAFCO, so we will not be filling out any absentee ballot. The other thing is that I attended the webinar that I wish she'd been here because I did send her an email. She was one of the persons that was on the webinar on 2 districts in discussion. One was Mike Carroll Emery with the Orange County and the sanitation district. They're wanting to divest themselves of the sewer lines and then having two competing applications to annex that particular area. And one, I think the takeaway there was the fact that they had a number of workshops and then public hearings with LAFCO. And then finally fell on approving the annexation to the Irvine Ranch Water District because of their history. The other one was, that was the two that I attended, and then as I did, I asked the 82449 be agendized with whatever legalese and how that's going to affect our Zoom meetings in the future.
All right, well, Joe, we really appreciate the fact that you go to these events and these meetings and is there, I would ask, can we, because I think it's beneficial, like, even for me, everybody on the commissioners to possibly attend some of these meetings, but I guess I don't, do we get a calendar that comes out to all of us? I don't see them.
Yes, and I can make that available. I'm sure Keene has it also. But
Maybe some update.
what's important, the conference is coming up, 18th, 19th of this month. And I think it starts at 10 o'clock, is LAFCO 101. And even though I've been on the commission as a regular, as an alternate, and 15 years on the advisory committee, every time I go to that, I learn something else.
It's in October?
It's in October.
Okay, is there one in the spring? Because normally we get new appointees in January.
No, they
So,
only have one conference, and that's always sometime in September, October.
Well, maybe, all I'm suggesting is perhaps the commissioners get a heads up in some conferences or things like that that might be nearby so that we can participate or say, hey, I can go to that one and learn some stuff. Because this is, as we learned today, there's a lot of moving parts in this commission and better we're up to speed, I think.
Well, I was remiss in sending the conference information to King. I thought I had, but I got problems with my email, so.
Okay, well, if we make that effort in the future, that'd be good. Okay.
So if you're not doing anything on the 19th, it'd be a good time to go up, and it's up there in Newport Beach. So it's a short drive up.
Okay, all right. Well, send that out in an email.
We will send a reminder email.
Yeah.
Through Kim.
All right, so the commissioners.
Well,
And if there's,
and those who only want to attend that one day.
yeah, okay, so there's options. So I just wanted to have the commissioners be
We
aware.
can have a group
there's a lot going on.
we can make an activity out of it.
There you go.
Yeah. Oh. So, is the new HR company buying? Okay. All right. I don't see any other comments, any other inputs, any other commissioners' inputs. Thank you very much. It was a lot of heavy lifting done today and good comments, and hopefully we get to a good point and move forward. Our next meeting is on November 7th. So see you then. All right. Thanks. Meeting adjourned.
Good meeting, thank you.
Thanks, Amy.
Gary had his hand up.
All right. Okay. Okay.
I just left it.